Can a laser make you feel better?
Let's find out.
Welcome to What's in My Shoe, the show where we talk about everything feet and no subject is off limits. I'm Scott, the host, and with me as always is Dr. Lockwood. Dr. Lockwood, but we're missing someone. Where's Dr. Risby today?
He is enjoying the sandy beaches of Mexico.
Wow.
Yeah, we let him take a vacation.
Wow, that's very generous of us.
It is, yes.
So today we're going to talk about this thing behind us. Doctor,
Yeah.
What is that thing?
So this is actually our MLS pain laser therapy that we utilize in the office.
Wow.
So isn't it pretty with that nice blue highlights?
Wow.
Yeah?
Yeah, so what does it do?
So I think the better thing to talk about is what it doesn't do, because pain laser can help with a whole bunch of problems. Yeah, Scott?
Can it help with my ingrown toenail?
No.
No?
No, not your ingrown toenail. Let me talk about some of the things it can do.
Okay.
So it helps with plantar fasciitis,
Which is?
inflammation of the ligament on the bottom of your heel. You have that.
I do?
Yes, you do. It helps with perineal tendinitis.
No clue.
It's that tendon on the outside of your foot that you always complain about when you don't wear your orthotics.
Wow, I have that too?
You do.
Wow, okay.
And it helps with Achilles tendinitis.
I know what your Achilles tendon is, but what is
Tendinitis?
tendinitis?
So, I mean, basically, you hear me saying over and over again, itis, itis, itis. It's an inflammation of something, usually a ligament or a tendon, or in some cases, it's even arthritis, where there's bone pain because of bone-on-bone grinding.
Wow.
So it helps with a whole host of things, just not ingrown toenails.
Darn.
It's okay.
So does it help with anything else that's not on the foot?
It can, actually. We do have some patients that come into us from other practices in the community that have elbow pain or knee pain or hip pain and things like that. So we are one of very few practices in the community that have this technology.
Wow.
Yeah. So the coolest part about the MLS pain laser is that it's a cold laser, and you can actually utilize it in two ways at once. Now, I don't have it fully turned on because we would need our fancy glasses. However, we will show you guys in a few minutes just how easy it is to make it work. I think the most important thing to remember with MLS laser is that it's painless. You actually don't feel a lot of pain when you're getting the treatment, which compared to a lot of other things that we do for people, like cortisone injections and things like that, this is something that is very, very helpful for a holistic or homeopathic treatment plan.
Wow. What else, Dr. Lockwood?
I think we need to talk a little bit about how patients come in for the treatment. So it's usually done between 2 to 3 times a week for 4 to 6 weeks to help achieve the best possible outcome for any acute problems.
Wow.
However, if you have a chronic problem like arthritis or even peripheral neuropathy, and that is when patients can't feel their legs and feet as much as they used to be able to, those patients actually work really well with a long-term maintenance plan, a maintenance treatment with it. So there's a lot of options. We go through everything with our patient population and really explain all of that to them.
Wow. So basically any itis that you were saying, any itis, it will help.
And peripheral neuropathy. So
And peripheral neuropathy.
you said it correctly. Good job.
I said it's lovely.
You did. One other thing we need to make sure we mention to people, and this is actually really important, Medicare and a lot of our other carriers, they consider this to be elective because it is newer technology and it's something that isn't necessarily allowed for, or in some cases, patients talk about it being covered under their insurance carrier. So we've worked really hard to make it super affordable for patients. We price point our packages to a level where it's actually about $40 to $45 a treatment when you get it done. So
Right.
It's really extremely affordable, less than most co-pays, and it's really very, very effective.
So how many treatments of this bad boy would you recommend? I know it probably depends on the level of pain and things like that.
It actually more so depends on what the problem is.
Oh.
So, like for plantar fasciitis, if it's only been going on for a month or two, you could probably get away with 6 sessions. Most of our longer itis problems, though, a minimum of 12 per side. And then with neuropathy and arthritis, that's when we talk long-term issues and long-term packages.
Awesome.
Yeah. Have you had the pain laser done on you before?
Never.
Really?
Really, no.
Why is that, Scott?
Do you want my real answer, or do you want me to come up with a fake answer?
I think your real answer is a fair one. Go ahead.
Well, for me personally, we just see it and I just look at it and you don't really see anything happening. You just see this little head go and move around and I don't know. I just don't see the treatment happening.
It looks weird.
It looks weird and futuristic and I just don't see the treatment happening.
Right. So I think that's a good segue for us to get it on you. What hurts today?
Actually, my foot hurts from where I stepped on the Lego for our next podiatry parody video coming soon. So that still really hurts, and that was a week ago actually, and that still really hurts.
So you stepped on a Lego. What is this next podiatry parody video about?
Well, you guys are just gonna have to wait and see.
Oh.
It involves
children.
It involves a song from a crooner of the 60s, 70s?
50s.
A crooner of the 50s, everybody.
1950s.
1950s. So
Or
you're just going to have to wait and see.
Our daughter puts it 100 years ago.
Yes.
Yeah.
100 years ago.
So, okay, well, I'm excited to see that parody video. And I'm excited to show you this so that you can see how much better this is going to feel afterwards. So, we're going to go ahead and take that B-roll with producer Chad and show you how it works. So, we're in the treatment room now, and we're going to be performing laser treatment on Scott. The very first thing I want you to know is that I, Scott, and producer Chad all have on safety goggles. So that's the most important part. We're doing two things right now. I'm using the robotic arm of the laser to treat right along his arch, because when Scott stepped on the Lego last week, he actually damaged and injured his plantar fascia ligament. And I want to make sure that I'm getting some massaging and some treatment along the plantar fascia as well as his posterior tibial tendon. The second thing I'm going to do is use my handpiece, and I'm going to actually have that over the area directly where he stepped down. Basically, he's got a bad bruise from stepping on the Lego. I think we should throw the Legos away. Comment below and tell me what you think. And how does it feel now?
I don't feel anything.
Okay.
I'm scared to not move. I don't want to mess it up.
We're using the handpiece for about 3 minutes here, so we're about halfway through the treatment. How's it feeling?
Feels better.
Okay, a little warm?
Very little warm. Yeah, not hot at all.
So the reason that Scott is feeling that little bit of warmth while I'm putting the laser on him is because this cold laser therapy actually breaks up inflammatory tissues and allows him to heal better. Laser therapy actually brings more blood flow to the area as well. So what we're doing is a twofold approach to help break up this inflammation. Obviously, the best thing he could have done was not step on the Lego, but since he did, we've got treatment for him. How does it feel, Scott?
Feels a lot better. It really does.
Scott, how does it feel?
You know what? It feels better.
I knew it would. You should listen to your wife more often.
It's not a bad idea, guys. Probably something you should do more often than you really do.
Probably.
Well, guys, that does it for this episode of What's in My Shoe. Be sure to drop us a comment below and tell us what you liked about this episode, and tell us if there's anything you want us to do in future episodes.
We're excited to make sure that you know that this is season 2 of What's in My Shoe, and we're going to have a ton of guest speakers and presenters and, just guests to the show. And we're really excited to have other members of our community join us as we talk to you about everything that's in your shoe.
So be sure to like us on Facebook, follow us on Twitter, Instagram, LinkedIn, and subscribe to us on YouTube. And as always, thanks to producer Chad. Shout out to Chad for putting this together, all the lighting sets, cinematography, editing. So that does it, guys. So be sure to join us next month for What's in My Shoe, and be ready for that 50s crooner parody video coming out real soon. Thanks, guys. Bye.
Bye.
If you like this video,
Be sure to leave a comment below, like the video, and subscribe to us on YouTube. You can also check out our Facebook page and like that as well, so you get notified the next time we go live. All right, everybody. Thanks. Bye.
I'm gonna be famous.
Bye-bye.